Hello, so this video is for patients of Abbey Dental who are doing home professional whitening. So far you should have been sent a video of the instructions, how to do the whitening. It's very typical when you come in that we will ask you to sign a consent form before we do start the procedure. We do that for every procedure, just to make sure that you're aware of what's being done and that you're happy to proceed. So I'm going to talk you through what that consent form says today, so that you can hopefully have a better understanding of what you're signing and a better understanding of the procedure. So the first thing I want you to know is that it's very common to get increased sensitivity of the teeth during the procedure. It doesn't mean that there's any damage being done or that you will have long-term sensitivity. It's just a byproduct that goes hand in hand with the treatment. So do expect during the 2 weeks that you're doing the whitening that your teeth will have increased sensitivity. And everyone's a little bit different. Some people don't feel it at all and some people feel it more than others. So please don't be worried about that. What you can do is, whilst you're waiting for your trays to be made, you can use a sensitivity toothpaste, something like a Sensodyne. That's absolutely fine. If you don't have any of that at home, you can ask to see if the surgery's got any samples that they can give you. So that's the first thing to note. It's very common to have increased sensitivity during the procedure and it's nothing to worry about. The second thing that you need to be mindful of is that teeth, naturally, you won't see it on this model, but they naturally have a slightly different colour. So the top part of the tooth tends to be whiter, and as it goes towards the gum, it gets yellower. Okay, that's how the natural tooth is. When you do the whitening, the top part, which is the white part, will whiten. This yellower bit down here near the gum might not whiten as much, and that's very common. It often, patients are often very happy because the bulk of the tooth is whitened, but just be mindful that the tooth will still keep that natural colour gradient. There still will be whiter up here, and if you've got, the tooth is slightly yellower down at the gum, it will remain like that after the whitening. So please don't worry about that, because as I mentioned, the bulk of the tooth will whiten. It's just the bits that are near the gum that tend to kind of remain their same colour or not whiten as much, because the natural tooth has a gradient like that. Okay. The other thing to be mindful of is if you have existing fillings or existing crowns, they will not whiten. So it's the natural tooth structure that whitens. Very often we do this procedure before somebody's about to have fillings or before somebody's about to have a crown, so that we get you as white as possible, and then we do the filling or the crown. Okay, so for most people it doesn't affect them. It might affect you if you have something right at the front, and then you can discuss with the dentist whether you want to replace that in future if you're looking for a whiter colour. Patients often ask me, well, how white will I go? The home professional whitening we get really, really good results with. The extent to which your teeth will whiten is very individual, so you'll definitely go whiter. We will give you the strongest stuff that we can legally prescribe you on the market that's still safe for you to get you as white as possible. But everyone's really individual with it, okay? Typically we do take before and after photos and we see quite good results, but it's not the same for everyone. Some people will go 6 to 8 shades lighter and some people will go 3 to 4, okay? So we will give you the strongest stuff that we can to get you as white as we can. The other thing that patients often ask is how long this lasts. And again, that's really very variable. Patients that smoke, drink a lot of red wine or tea or coffee will find that their staining kind of will come back quicker, versus patients that are very good at brushing and don't have a lot of staining foods or drinks. They'll find that it lasts a very long time. So you've got two options with regards to maintaining the whiteness of your teeth. You can either wait for the whitening to completely wear off, and typically for most patients that takes about 8 to 12 months. You can keep your tray and then just buy the gels. The gels are fairly inexpensive, and do another 2-week course in the tray in 8 to 12 months time. If you don't want to wait for it to wear off and you really like your white result, what you can do is buy the gels and put the gel in the tray 1 to 2 nights per month, okay? And that will help maintain your white result instead of you waiting for it all to go away and have to do another 2-week course. So those are your two options for maintenance, and the great thing is, as I said, you can keep these trays and you can just buy the gels, and they're fairly inexpensive, and then you can choose which way you'd like to maintain your result.